in the syllabus that need to be weaned off. That is one. Number two, most medical students don't pay attention to details. Why? Because they have ego. In universities, you'll see medical students bragging that they are the best, that they came out with an A, that they are this and that, and they want other students to actually fear them. That's why they still carry the same ego even out here, and they think they are the best out here. No, they are not, because they are suffering from the same conditions they are trying to treat. So during preclinicals, the first year, the second year, thereabout, these guys, there's a system that teaches you biochemistry, teaches you anatomy, parasitology, microbiology, and all these things. And medical students and pharmacy students and nutrition students, they tend to ignore this. Because pharmacy students are busy thinking, you know what, I want to know what is this 2 times 3, this mathematics on a bahasha that doesn't end, that doesn't have an answer. They are thinking, I need to go to the field and actually make sure I dispense. I need to go actually to the field. And this is the mindset of a pharmacist or a pharmaceutical technologist. That I need to just walk through the system, I get a license, I open my own pharmacy and become rich. And actually, those people who are actually rich in the medical field are pharmacists and pharmaceutical technologists, because they open up pharmacists and chemists and all they care about is profits. Nothing more, nothing less. They don't care about your health. Do you think they do? All they care about is how they will make money and pay bills and become rich and drive these double cabins. They call them pharmacist vehicles. And then they call themselves legal drug lords. They have a label. You know, I'm a legal drug lord. You're not a legal drug lord. You don't even understand what you did. So in the first year, and now the MOs and the clinical officers, in their head, they're just being brainwashed to think, oh, you know what, I'm the best. I understand the human body better. But they skipped anatomy. They were there physically attending, but they did not attend mentally. They were busy thinking about other things. Ego was coming in. They didn't see the bigger picture. Oh, you ask somebody who has done medical lab, ask them about parasitology. They are so empty. Experience ya kazi ndio inafanya tu wanakumbuka vitu kadhaa. But truly, I'm telling you the truth. Some of the medical practitioners don't even remember anatomy, basics anatomy. The things that I talk about here, the fructose metabolism, the glucose metabolism, the breakdown pathways of these things, these are things that were taught in first year. Biochemistry 1, biochemistry 2, biochemistry 3. There are things that are taught there. These things of proto-oncogenes and oncogenes, genetics is actually taught in second year or the beginning of third year. But they were not concentrating. All they do is to cram, because now degrees are communal. They are community things. They cram, they pour on that paper, and if you ask them the questions they saw in that paper, after the paper, they don't remember a thing. So we are just looking at, oh, I want to graduate and go start a pharmacy. I want to graduate and go into a hospital where I wear a lab coat and scare patients. The course, how it's outlined is the problem, is the setup. Because somebody is doing 18 units in a semester, there's another guy who is doing 6 units. There's another one who is doing 3 units. And all these guys are in the same institution. This guy with 3 units wants to have all the fun. He wants to play PlayStation all through and do everything. Every activity is here, is there. Now, these guys who are here trying to load stress in their heads, calling themselves medical students, are the ones who are so stressed. They want this life again. Some of them will do the 2 lives. They want to juggle this life and this life. So nobody is there to actually understand anything. They are there to cram, pour on a paper and disappear. And I'm telling you the truth. These are the same people who are coming in to actually destroy you. They're the same people who will get angry when you ask them a question. They're the same people who don't even understand the basics. How can you not understand the basics of anatomy, biochemistry, and then you still come out and argue that you're a doctor? You're a doctor by title. You're not a doctor by understanding. You're just a doctor by title. If I strip off that title, you have nothing. There's nothing between your ears. So you went into the system and came out, and because the one who taught you there is the one who actually supervised you during internship, you are regurgitating everything he says. Look at the doctors who are supervising these interns, the consultants. They are so angry. They have a lot of anger because of what is happening in their families. They bring that into the hospitals. They want to exercise some form of duty, because in their heads they have a lot of ego. They want to show these interns, you know what, I am the consultant here. They call them consul. Now konso asiposema hii atufanyi. Oh, huyu konso anajua. Huyu konso ako na hii, ako na masters. Konso ni prof. Prof akikuja lazima tusikize. Prof anakuwa mkali, so all of them are even wanting to stand in the back row because they don't want to answer questions from the conso. But the conso is so conditioned, and the higher he goes, even the more empty he becomes with the basics. So most medical students, not all, most medical students don't even understand what they are doing. They are following protocols, they are following guidelines, and that's why they will tell you hypertension is irreversible. Some of them are even using YouTube. They seek a condition they've never come across, and now they're going to YouTube. They don't want to consult because ego does not allow them. They'd rather go to the toilet and go for YouTubes. It is so unfortunate that this is what is happening in the medical classes. I know because I've been there. 18 units at nisome nielewe. If any case, the only time that I started paying attention to medical related stuff to understand is when I had no pressure for examination, and this is after my internship. That's when I decided now I have to go deeper into it and understand it. How many of you medical students on board have done that? How many? After school, you are now egoful. You went on the podium with that cacophony of viewers, you took the oath. After taking the oath, you've done nothing according to that oath. You've done actually everything the opposite. There are laboratories now that actually want commission from doctors. They tell you, if you send me this number of patients, you get a commission. You know those laboratories? So it's all about how many patients you're sending to them. It doesn't matter. Even if a patient is just having a common cough, take them there for an x-ray. Take them there for a sputum test. Because you want the commission. You know very well. There are pharmacies that have signed doctors. Doctors are on the payroll. And these doctors have to send patients to that pharmacy, that specific pharmacy. And all they write on a prescription is do not substitute. Do not substitute. Go there and buy this brand. Yet they've written drugs in the brand names, not generic names. They've prescribed in brand names. So they send you to a specific pharmacy so that you go there. Once you go there, immediately they get that prescription. There's a commission for this doctor. Oh, it's a big disaster in the medical field. A big disaster, and it's a shame that a doctor can sit there and tell a patient you're going to die in the next 3 months. You're going to have this hypertension for a lifetime. You have to take drugs. You're busy selling patients the fear just because you're on a payroll from the big pharma. The same thing you're doing here is the same thing your father is experiencing in the village. That is one thing you don't know. Your person may be a patient hapa is going to be to buy drugs for your father in that village anyway. So ego has made sure that doctors cannot think outside the box. Money. They have an identity of money. They don't have the identities. They have identities of money. Ego has made sure that doctors do not think outside the box. They can't. I'm telling you. If there is no guidelines, these doctors cannot think. And that's how these organizations actually kill us. These organizations come in with agendas to sell you fear. And once you buy the fear, they sell you the solution in form of vaccinations and all that. And doctors are actually on the leading line for this agenda. But they don't know. They are in the fallen state. They are always confused. They are in the dark. They can't see the light because they have failed. They just pushed themselves through the system. Some of you got an A, yes. An A that was bought. And then you went into a school, got nothing, but you went through the system anyway. Some of you bought those papers that you call degrees. Some of you got into this because your father is a doctor. You didn't want to be a doctor, but because your father is a doctor, he knows how to pull strings here and there. You went into University of Nairobi to do medicine. Look at you now. You are struggling, you are stressed, but you cannot do anything. You're actually depressed more than your patients. But because unajua hii ni familia ya madaktari. Familia ya madaktari, who told you brains are sexually transmitted? Ati familia ya madaktari. You are struggling literally. How can you tell a patient aache kumeza dawa za hypertension or diabetes when you know your father owns a pharmacy? When you know you own a pharmacy, how can you tell a patient that, you know what? Oh, guys, diabetes is irreversible and you can do it through the kitchen. How do you expect to do that? How will you pay the bills? So I allow you. When you come angry at me, I allow you. I know you're in the fallen state. I can't even judge you. I can't even judge you because I understand where you are. And until you move out of that hell of yours, you will always be angry. You will always find a reason to actually go against what other people are saying, contrary to what you believe. And you see, belief hails from a center of lack and hails from a center of doubt. Anything that you believe in, you don't know. You just believe. There's doubt. All the same. Let's go to cancer of the lungs. Poleni majama, poleni sana. There are very few and limited number of doctors who are doing it right. Very limited. Wachache sana wanafanya the right thing. Very few doctors have the guts to actually do what is right and not do what is in the guidelines. Understand that statement? Very few doctors are doing what is right. They are upholding righteousness. Very few. Oh, you think you want to see your doctor driving a Probox? Your doctor has ego. Anataka Mercedes Benz, anataka TX, so that you can listen to him when he's telling you zero things. Anataka uone akishuka ndani ya TX ndo akuambia useless things. But because you've seen his status, you've seen his life already, you will believe it. Anyway, lung cancer. Now you remember, we will do a recap here, of course, as usual. So we have the tumors. If you were here from Monday last week all the way to today, you understand. We have tumors, and those tumors are divided into two. One side is the benign. Benign, we say they are local, they don't spread, they are easy to treat. You can do a surgery to remove the tumors. You can give radiation to actually shrink the tumor, and then you can give chemo to actually destroy the tumor. No problem. This other side, we have the malignancies, the malignant, which you call the cancers now. Okay, so we said all tumors are not cancers, but all malignancies are tumors. That's simple. So this side we have benign, this side we have the malignancies. When you hear the word malignancy, it means they spread. And when they are spreading, now we will have to divide them into two. One side of malignancy is those that actually prefer spreading through the lymph system or lymphatic system. The others like spreading through the blood system or the connective tissue. Blood is part of the connective tissue. So we have the connective tissue and we have the lymph, those two. Those that spread through the connective tissue are called sarcomas. Those that spread through the lymphatic system, we call them carcinomas. So when you hear hepatocarcinoma, it means this is a liver, because hepato is the liver. Carcinoma means this is a liver cancer that prefers spreading through the lymphatic system, the epithelial tissues. You now understand? So therefore, if I slap you with hepatocarcinoma, tell me, daktari, you just say liver cancer. I know already liver cancer spreads through the lymphatic system. So tell me it's liver cancer. I understand. That's a hepato, daktari. Hepato. At your bronchocarcinoma, please just tell me it is cancer of the lungs. I understand that cancer of the lungs spreads through the lymph. Don't put these words there to scare me, daktari. You want me to go straight to chemo? I understand. But you tell me, what is this? It is lung cancer, and because it spreads through the lymphatic system, it is now called carcinoma. You see that? Carcinoma. Anyway, lung cancer is part of those that actually spread through the lymphatic system. So lung cancer is part of the carcinomas. Pancreatic cancer, we tackled it. We said it also spreads through the lymphatic system. So it's part of the carcinomas. At least you know of the leukemia, which is the blood cancer and spreads through the blood. That we classified it under the connective tissue, and that is the sarcomas. There's another one that affects people who have HIV on the skin. It's called Kaposi sarcoma. Sarcoma means it spreads through what? Connective tissue, the blood. So once you understand those basics, you will not go wrong. Hautaenda wrong, hautaogopa. So lung cancer, we said, we classify these cancers into two. One, we say these ones are the ones that are highly, they have high incidence, so they occur so many times. Like they are the most common. So on the list of the most common cancers, number one is the breast and the prostate cancer. Number one of the most common cancers is the actually breast and the prostate cancer. We will talk about it, I hope, next year. Number two, we have the lung cancer. So you see lung cancer is coming number two as the most common lung cancer. As the most common type of cancer, that is lung cancer. And then number three is the colorectal cancer. Tomorrow we are having a live to just summarize this. We'll talk about colorectal cancer. So I'm hoping that tomorrow we can actually finish up on this colorectal cancer. We remain with only breast and prostate cancer that we'll carry to next year, if God gives us the grace to live tomorrow. Okay, good. So those are the three, the most common: breast, stroke, prostate cancer. Number two is the lung cancer, and number three is the colorectal cancer. Now, when we go to the types of cancers that actually cause death, number one is the lung cancer. Do you now see why it is important for us to talk about the lung cancer? Because it is number one on the cancers, on the list of cancers that actually cause death. Lung cancer, number one. Number two is the breast now and the prostate cancer. So breast cancer has now been demoted from being the most common to being the number two on the ones that actually kill. Number three is the colorectal cancer. So colorectal cancer maintains at number three on both cases. And then the last one is the pancreatic cancer. Remember we talked about pancreatic cancer being number four, or a type of cancer that causes deaths. So that is what we call the morbidity. Okay? Ukishaelewa hivyo utajua the reason why we are talking about lung cancer tonight, because it is actually number 2 on the most common cancers, and number 1 on the cancers that actually cause death. Is number 1 on that list. And why is it so? It's because lung cancer, the prognosis is very poor. Number 2, it spreads very fast. And number 3, a bigger percentage of lung cancers are secondary to other cancers. So it's what we call metastasis. So you have a different cancer. Let's say you have a colorectal cancer, and then it has actually spread into the lungs. And now we diagnose you of cancer, and we've ignored the colorectal cancer. We've ignored the breast cancer. We've ignored the high estrogen levels in women. So we diagnose you of lung cancer at stage 4, but lung cancer was secondary to breast cancer. Simply spreads from the breast to the lungs. Problems, right? So now you understand. That's how it's difficult. Now, the symptoms of these cancers, we know very well. If you have problems with the lungs, there's obstruction, there's feeling of fluid, and now we start wheezing. But most importantly, cough. And cough is a very general symptom. People who have TB, they will cough. People who have pneumonia, they will cough. People who have just inflammation of the bronchioles, the bronchitis, they will cough. People who have COPD, they will cough. So you see, cough is a general symptom. But I want you to know this, that when somebody is experiencing cough and shortness of breath, even asthma, they will experience this, right? But when somebody is experiencing a cough or difficulty in breathing, which you call the dyspnea. When I say dyspnea, people are like, the what, doctor? Shortness of breath. Don't go into many terms. When you have those 2 symptoms, the obvious ones, chances are high you're suffering from different conditions. And these conditions can be classified into 5 categories. 1, obstructive lung disease. So I'll tell you this, I'll read to you this so that you can actually understand. So when you have a cough or this persistent cough, leave alone the cough that lasts for about 3 to 5 days and is gone. There are coughs that will last for a long period of time. Right now, even the reflux disease, the GERD, is giving people a lot of cough. You'll see people waking up in the morning and they're busy clearing their throat every time. So if you constantly do that, it's time for you to go for a good checkup. That is number 1. Number 2, it's time for you to fix the gut, because that reflux is the one that is actually giving you that irritation here, and you're constantly having this morning cough. So go and rule out that, rule out other conditions, then start fixing the gut. Good. So 1 is obstructive lung disease. When you hear the word obstructive, it means there's something that is actually blocking the airflow or the airways. So which diseases are classified under this number 1 classification, which is obstructive lung disease? COPD. Chronic obstructive pulmonary disease. There is one condition that we talked about that causes you to snore at night, the obstructive sleep apnea. Oh, if you did not attend that live, you need to go and check that live on obstructive sleep apnea. Oh, guys, if you just take time to just go on my live section on YouTube and just go through the playlist on lives, you can never go wrong. They are long playlists, but they are so interesting, they are so detailed, and you learn something new. Anyway, we have also asthma. So we have COPD, we have obstructive sleep apnea, we have asthma, we have bronchoectasis. This bronchiectasis is one of the conditions that people get when they are young, and then they think it's asthma. And then when they get older, maybe 3 years and above, it disappears. Have you seen those people who say, oh, mimi unajua nilikuwa na asthma nikiwa mtoto na ikapotea? That is not asthma. If you're still eating the same foods, the wheat, the cereals, that is not asthma. That is bronchiectasis. So it comes in and then disappears when you're growing older. And then, of course, we have cystic fibrosis. So those are diseases that are classified under category 1. Category number 2 is what we call restrictive lung disease. Restrictive means you are unable to actually expand and relax the lungs easily. Now, if you're on this live and you cannot like live, you can be a very mean person. The only thing you can do is just to enjoy the content and like the live so that it actually gets to spread to more people. It's that simple. So do us the honors. All the same. So obstructive and then restrictive lung disease. And under restrictive, CF is also there. The cystic fibrosis. When you hear the word fibrosis, just know it's a scar. So your lungs are forming scars. And therefore, scar makes the lungs have a hard time to expand, because a scar is a very hard thing. So it makes the lungs have a difficulty in expanding and contracting. We also have people who have inhaled dust. So now allergens and pollen are coming in here. So dust, we have also radiation therapy. When you're going for those screenings and the x-rays and you get exposed to those radiation, they can actually bring you restrictive lung disease. And then you have obesity. As you grow fat, you're restricting your lungs from actually helping you to breathe naturally. Number 3, we have the pulmonary vascular abnormality. Now, pulmonary means the lungs, vascular means the blood vessels, and then now abnormality. So we have abnormality in the blood vessels that actually supply the lungs. And remember, the lungs are highly vascularized. They have a lot of blood vessels. Why? Because this is where we have the gaseous exchange. We bring in oxygen into the blood and we bring out carbon dioxide. Because if you have buildup of carbon dioxide in blood, you will end up getting into what we call respiratory acidosis. So you must breathe the CO2 out to bring down the acids in the system. Okay, so under the pulmonary vascular abnormalities, of course, we have hypertension, the pulmonary hypertension. The ones that people are given Viagra. Viagra was designed for pulmonary hypertension, an increase in blood pressure in the lungs. So actually, Viagra lowers your blood pressure. This is why people end up dying in action. And we celebrate you. This gentleman, he died, the soldier died in action. Oh, amazing. Amazing. Gentleman was was pounding the arm and then ended up overdoing it. So the blood pressure went down and whoosh, gone. And he was taking a drug that is supposed to lower blood pressure, and he's on drugs that actually lower blood pressure. So he's on antihypertensives to lower blood pressure. Now he has taken another drug to lower blood pressure even further. What do you expect, gentleman? What do you expect? Oh, the gentleman died. Soldier alikufa kwa action. Anyway, let's keep moving. So we have hypertension, and then we have the one that is called pulmonary embolism. Emboli means either blood clot or just a globule of fat. So we have thrombi and we have emboli. Emboli are basically coming from these globules from fat and all that, and then embolies or thrombi are coming from blood clots. So these are what we call the pulmonary vascular abnormalities. And then infection. So when you have these conditions, of course, we expect you to cough. You can even cough blood. And then now infections. TB is there. You cough even blood. Pneumonia is there. Some of you are suffering from just inflammation of the bronchioles, and you constantly say, niko na pneumonia. Unajua nilipigwa na baridi, ni pneumonia. Nilitembea kwa mvua, niko na pneumonia. Mvua ikuji na pneumonia. Pneumonia is an infection, my friend. You must get a diagnosis. So pneumonia is there, TB is there, bronchitis is there, and of course, lung abscesses. When you hear the word abscess, just know it is a fluid that is filled with pus. Abscess is a pus-filled a sac. It's a sac that has pus. Amazing. And then the last group, which is number 5, is what we are talking about tonight. These are the malignancies, the cancers of the lungs. So when you have all these 5 conditions or 5 categories of conditions, coughing is part of it. Shortness of breath is part of it. Coughing blood is part of it. So you can't just say, because I coughed blood, I am now here. And even medicine, some medicines actually cause these problems. So you can't just jump and say, I have cancer. Or you start getting the fear. Could it be cancer? Of course it could be cancer, but it's not necessarily that it's now cancer. So you need further tests, further examinations to actually get a surety. So this is those people keep saying, Daktari, unajua nimecough damu. What could be the problem? You want a diagnosis online. I'm telling you, it's not possible. Drop that idea. Daktari, after I started these diets, I have coughed blood. I've coughed blood, Daktari. Daktari, I have shortness of breath. At night, I'm struggling to breathe. What could be the problem? I mean, how can I even know the problem? I'm not a prophet. You must go for physical examination. You must go and give adequate history. And through that, you'll get a proper diagnosis. So on the cancers, the malignancies, we have the ones that are central and the ones that are peripheral. Central, you have a trachea that separates into 2 bronchioles that separate into small, very minor bronchioles, and then they spread into the alveoli. So when they are near the alveoli, that is peripheral. Peripheral is far from the center. And then central, from the bronchi, from the trachea to the bronchioles to the bronchi. That is central. But ikienda mbali sana huko ndani ya alveoli, hiyo tunaita peripheral. And these malignancies are the problem. And that's why we've chosen to speak about malignancies and cancer of the lungs tonight. Is that not a good history? So that we can actually jump into it? So now the question comes in. Why is it that lung cancer has the highest incidence and has the highest mortality? Of course, not its highest incidence. It's number 2 on the incidence list and is number 1 on the mortality list. Why is that so? So why is cancer of the lungs so dangerous? That is the question actually. Don't go into too many stories. Oh, amazing. Who is this who is supposed to give us, has decided to give us a present here? A gift. Thank you for gifting us. Anyway, why is cancer of the lungs very dangerous? And why do we need to talk about it? Number one, it is very difficult to screen cancer of the lungs. Now you see, this cancer spreads through the lymph nodes, the lymph and the lymphatic system and the lymph nodes. If you have tonsillitis, when you do a palpitation of this, the tonsils, you will feel some form of pain, right? But nodes that actually this cancer affects most are behind the sternum. The sternum is this bone here. See this bone that rolls from the neck all the way down here? The one that actually supports the ribs. The glands that are behind that sternum are the ones that are affected with this cancer. That's why most of the times you do an examination, it is not, because those glands are hidden behind the sternum. You cannot do an examination of lymph nodes behind the sternum. That is one. Number two, there's no much pain, because by the time you're getting here, you already have another type of cancer, possibly. You just didn't know. So you've treated other types of cancer. You've tried to treat colorectal cancer. You've tried to treat breast cancer. You've chopped off your breasts. And then later on you're told, you know what? Kumbe, the breast cancer had spread to the lungs. So by the time you're getting this diagnosis, it's already too late. So it's difficult to diagnose it adequately and to screen for it. Number two, many patients are asymptomatic. There are no symptoms. They just experience symptoms in other organs. For example, when cancer has spread into the heart or into the brain, they start experiencing different symptoms. So when they get the brain tumors, possibly it's actually a spread from the lungs. When they get the liver cancer, possibly it's straight from the lungs. So by the time they are getting a diagnosis, they were getting a diagnosis of an other organ, cancer that has spread from this organ from these lungs. So you see how difficult it is. Ningumu. Before we screen ujue hii ni lungs is go involved, there's a lot of things. You've treated TB when this guy was coughing, it subsided, came back. You've treated pneumonia, subsided, came back. You've went for the bronchitis, nothing is coming out. You've done a chest x-ray, you see nodules. Now you can now say, oh, you know what, now this is a problem here. Maybe we could do biopsies. But I'll take you through diagnosis and you'll see how broad it is. That's the reason why it's actually hectic to actually screen for it. So you've even treated asthma. And how many of our people are constantly taking beta-2 agonists, salbutamol? You call it Ventolin. There are people who are constantly taking Ventolin and they are busy knowing that they have asthma. There are people who are always constantly on prednisolone, the steroids. So they take the steroid, their lungs open up a little bit, the inflammation is gone, they believe their asthma is gone, and then next week again they are on another steroid. There are people who constantly are on an inhaler that has the steroid plus salbutamol. Just the same way we said, most people who keep on treating gastritis and the ulcers and H. pylori end up coming out with the pancreatic cancer without even knowing. This is the same case here. You're busy treating asthma, you're busy treating bronchitis, you're busy treating pneumonia, you're busy treating TB, yet the real animal is just building itself underwater. As you suppress the symptoms of this animal, thinking that it's another disease, the animal is busy building a home just from inside. And by the time you get the true diagnosis, it's already spread into other organs. Yes, 𝗦𝗘𝗥𝗧. You're taking this drug, and some of you even the cetrizins. People know that, you know what, when I have this difficulty in breathing, I'll go take 𝗦𝗘𝗥𝗧. I'll go take nedocromil. I'll use my inhaler. So you never take it serious. And even if you go to the hospitals, the clinicians are following guidelines. So they'll check the symptoms, they will send you to the lab, maybe do a sputum test. They rule out, the gene expert, they rule out TB. They put you on some steroids and antibiotics because they're thinking it's an infection. You go take those antibiotics for 10 days or 5 days, thereabout, you get a bit better a little bit. After 2 weeks, you're back. Sometimes it goes for about a month and then you come back to hospital. Same diagnosis, same medication. And now you even get used to the medication, and the next time you're going to the hospital, you don't even need them to actually diagnose you of anything. You simply go straight to the pharmacy and buy Augmentin. And buy prednisolone. You know, mimi nikimeza PDL, you call it PDL. Mimi nikimeza Augmentin na PDL, kifua yangu inakuwa sawa. Mimi nikipata ceftriaxone injection, niko sawa. Hii pneumonia yangu inataka tu injection ya ceftriaxone. Ama gentamicin. Are you not a culprit of that? Wewe si culprit. Hii ni monia yangu. Hii asma yangu kama sijadungwa theophylline mimi siko sawa. Hii ni monia yangu kama sijadungwa hydrocortisone sitakuwa sawa. So you keep on suppressing the symptoms. Nimegusa watu mahali. So that is number 2. Number 3. This cancer, when it starts to spread, it is very rapid. Cancer of the lung spreads so fast and the prognosis is so poor. It is so poor. And have you had at your lung transplant? Have you had it successful lung transplant? We need to have people who have actually had these transplants. Watuambie. At least we know of kidney and liver transplant. But have you ever heard of lung transplant that was successful? The complications that are coming after that, trust me, we will call it a success maybe 48 hours after the surgery. And the surgeon will take the bragging rights 48 hours after that. And I told you, most people die in the theater. Most people die in the theater. But because you've signed a consent to protect the doctor in the theater, you will be pushed on oxygen into the recovery room, into the ICU. And then the death will be recorded in the ICU. True or false? Wakisikia hivi wataanza kudemonetize channels, ndio? True or false? Our people die in theater, but because they signed a consent to protect the doctor. Hai, daktari mga ataka kuharibu image. Prof, haribu image. Aje, you died in the ICU. But what killed you in the ICU? Are they not complication of the surgery? Yes, he died of complication of the surgery in the ICU. But people die in the theater beds. Wewe. Ni watu wangapi wamekufa wakifanyiwa surgery ya appendicitis? How many? How many people have died after the surgery of appendicitis? They didn't die from appendicitis, they died from the surgery, the botched surgery. How many? Anyway, let's continue. So rapid progression and rapid fatality. So it spreads so fast and the prognosis is very poor, people die. Somebody saying you can't blame them, they tried. We know. Unfortunately, we know they tried. We know. Hiyo si ati hatujui bro. We know. Okay? So kazi yetu ni kusaidia, you don't go there. You don't go there for the trial. Our job is to make sure you don't go to hospitals for the trial. Our job is to make sure you change your kitchen so that you don't need to go for the trials. Trials tunaachia footballers, ndio? Number 4, cancer of the lungs, most times it is secondary to another cancer. Specifically, the colon cancer in males, the breast cancer in females. Nowadays, we even have breast cancer in males. Could it be because of the man boobs also? But anyway, all of us have estrogen. So don't blame men who have boobs and you're like, hey man, you have boobs, you might end up getting breast cancer. It's not that serious. All of us have estrogen. You can have an exposure to breast cancer. But breast cancer mostly in women and colon cancer mostly in men. So it spreads now from this all the way to the lung. So by the time you're getting a diagnosis of the lung cancer, there's another cancer. So you will basically die from 2 types of cancers without even knowing. That is what we call metastasis. Metastasis means spreading. And that's why it's very hard to come out of this. So then, after understanding that, what are the symptoms of this? Of course, you know, and you can easily put it in the comment section. What do you think are the symptoms of lung cancer? As you put it there, I'll advertise my platforms. I have a platform on YouTube called Health and Wellness Sport. Go there and subscribe. Go there and like the live. Let it get to more people just like you who are interested in getting this. There are people, you know of somebody who has a problem. You know there's somebody somewhere who you know very well. They have diabetes or hypertension or they have cancer and they are spending a lot of money on these things. You know that, right? You know that. Hatukosi mtu ambaye in our lineage has diabetes right now. If you mention 10 of your friends, 7 of them or even 10 of them, they know somebody in their family who is suffering from diabetes, who is on diabetes medication, and they know that this is going to last them for a lifetime. It's not true. Answers are coming in handy. So we have a channel on YouTube called Health and Wellness Sport. Go and subscribe. We have a platform on TikTok that we are running a live on. It's called Health and Wellness Sport. Just follow. We have a Facebook platform that is called Lewis Muchile. Go there and just be part of the generation. Then we have another interesting platform on Telegram where we share these things without limiting, without having to censor. Telegram is called Health and Wellness Sport on Telegram. So go join that. And then we have a contact that we use for both online and physical consultations. The contact is 0707. Let me just put it on YouTube. 0707074722. This contact is always on my platforms, on the videos on YouTube. 0707074722. This is a number that you can actually use to book your appointment with us. Use WhatsApp. You can text through WhatsApp. So don't go there and then text, and then when they tell you there's no response on normal text, you start complaining. Go there and text on WhatsApp. Text what you want. Not tell us the whole disease history on that contact. Tell us, this is what I need. I need a consultation with the doctor on this and this and this. Provide your lab test. You'll be guided, and then you'll be booked for an appointment with me. On a personal level, we'll have this conversation. You'll ask those questions that you've always wanted to ask, and we will answer. So use that contact. And then we have merchandise that we sell. We have fermented cabbages. Thank you so much for each one of you who is actually making an effort to go and buy those. As you buy those cabbages, you're supporting a whole generation. It's a whole movement. Fermented cabbages are there at 𝗟𝗡𝗥𝗚 House, second floor, shop number 60. Brian is going to sort you out. We also have coffee, roasted coffee, so it's for brewing. Go there and buy the roasted coffee. We also have tallow, the sheep tallow. You can also go there and do what you need to do. Okay, so thank you so much for supporting us. We can't do without you, of course. Good. So yes, I'm seeing some answers here. Anemia is part of it. Yes, thank you. Weight loss, yeah, that's perfect. We have coughing up blood. Yes. Coughing blood, that's called 𝗟𝗡𝗥𝗚𝗚. Hey, these are medicine, my friend. We have difficulty in breathing. Yes, somebody has also said here shortness of breath on YouTube. Had difficulty in breathing. The answer is very clear. Oh, you guys, you become doctors. 𝗟𝗡𝗥𝗚 House, second floor, room 60. Make sure you use the entrance that is on the side of Beba stores. Use that entrance, go to the second floor. Brian Omwenga is there. I've provided this contact on my platforms. You can simply go there and check those platforms. Specifically on Telegram. The number for this guy is on Telegram. Use it to call him. He will sort you out. Amazing. Amazing. Good. So yes, shortness of breath is there because now your lungs are struggling. We have obstruction, we have restriction. So the lungs is actually struggling. We have coughing, and this cough comes with blood. And it doesn't go away. You're taking steroids, it's still coming back. We have unexplained weight loss. We have anemia. Sometimes you can have acidosis because of the buildup of CO2 in blood. And therefore you start having this shallow breathing but very shallow and very fast. Because your body is trying to clear this out. We have these chest pains, you know. These are symptoms that you people know. But you can easily relate them with asthma, with bronchitis, with pneumonia, right? So you see how difficult it is. By the time we are getting there to get to put our finger on a differential diagnosis, we have done literally everything. So why would you wait until you get to this level? We have coughing blood, we've said that. And then there's something that is interesting. When they run the blood test, the CBC or the full hemogram, angina is a different one though, because angina will get the sharp pain that radiates to the left hand and to the back. See, that's a very unique symptom, right? So that's a different one. But a very good trial, Jesse. I like it when somebody challenges us that way. Amazing. So anyway, so there's something that happens when this cancer starts to spread. Remember, it's spreading to the near organs and then through the lymph. And it gets to attack the epithelial cells that are called the squamous. Do not cram the word squamous epithelial cells. Just know that there's a gland that is called the parathyroid gland. It is made up of those epithelial cells that are actually called the squamous epithelial cells. So when it starts to spread, it gets here and attacks these squamous cells. And these cells are the ones that actually get confused, and they produce a hormone that is similar to the parathyroid hormone. This hormone is called the parathyroid hormone related peptide. So it's just the parathyroid hormone, but we add on a small word they are called related peptide. So it's related to the parathyroid hormone. And you know very well, the works of the parathyroid hormone is to increase calcium in blood. So when you have low calcium in blood, this parathyroid hormone goes and helps in improving or increasing the levels of calcium in blood. Remember, high calcium in blood is a very serious problem. We've talked about it multiple times. But this hormone that is called the parathyroid hormone related peptide is the one that acts the same way to the parathyroid hormone. So what does it do? It goes into the bones Because now the message that is coming into the system is we have low calcium in the system. So it goes into the bones and causes resorption. Resorption means you're breaking down the bone to release calcium. Therefore, you're weakening the bones. So you see that's another symptom. So you start experiencing weak bones. Can you now understand? Can you now unaweza shikanisha? So this hormone coming in to break down the bone to release calcium into the blood starts to weaken the bone. Therefore, osteomalacia. But as it's breaking down the bone to release calcium into the system, it is also causing absorption of calcium from the GIT, from the gut, and also reabsorption of calcium from the kidneys. Therefore, we start having all this calcium coming into the bloodstream, and then we have this symptom that is called hypercalcemia. I like it how that is explained. So we increase calcium in blood. When we're increasing calcium in blood, how do we do this? Because it's now low. The message is there's low calcium in blood. So therefore, simply turn to the bone because that's where we have our calcium. Break down the bone through resorption, bring the calcium in blood, start increasing the levels of calcium. But remember, this is a condition that is causing this. So this is not a normal thing. It is the cancer that is actually causing this. So therefore, it's an abnormality. So we expect no regulation of this calcium. As we are breaking down the bone, we are bringing calcium into the blood, we are messing up with the bone. As we are absorbing calcium from the gut into the system, we are messing up with the system because high calcium in the system also causes constipation. So you see now they also experience constipation. As we reabsorb calcium from the kidneys back into the system, the reabsorption is also going to cause us problems because we are going to have the kidney stones. So when you eat now your spinach, you get the oxalates, they combine with the calcium, we form calcium oxalate, those are kidney stones. Now I want you to see all these symptoms. We have the kidney stones there, we have the constipation here, we have hypercalcemia here, we have weak bones there. So imagine all these symptoms are linked to one type of cancer. So even if you are the oncologist here, can we really blame you here? It is difficult because mara umepewa calcium supplements again because unaenda hospitali and you have these weak bones, the injuries all the time. Now you're given calcium supplements. The thing that doesn't hit your head is possibly I have a lung cancer that is causing high calcium in the blood by breaking down the bone. And now I'm taking calcium supplements that are going to increase more calcium in my system. And when you go into hypercalcemia, we are going to get hypertension. How are we going to get hypertension? Calcium deposits in the blood, in the cells that line the blood vessel. And calcium is a contracting blood, the element. So it causes contraction. When it gets into the cells contract, and now the blood vessel narrows. Because when they contract, they cause this narrowing of the blood vessel. Now we have an increased blood pressure. Now, in the heart muscles, when calcium is coming in handy, it gets into the heart muscles and they contract. And now we have this, what we call the arrhythmias. So we have these abnormal heart rhythms. We can even get a heart attack because the heart is actually contracting forcefully. And because we have this narrowing blood vessels, the pressure is increasing, we can get this rupturing of these blood vessels. If that rupturing is happening in the brain, that is hemorrhagic stroke. Aneurysm is happening. We have all this ruptured internal bleeding. So imagine all these symptoms being linked to one thing. That's why it's so difficult to screen for lung cancer. Because we'll be handling different things. You'll be handling drugs for hypertension, to ease up on hypertension. We'll be giving you calcium supplements at the same time. We'll be giving you drugs or surgeries for the kidney to remove kidney stones. Somebody will be targeting the bones. Somebody will be targeting some other thing. We are targeting to reduce calcium in blood by giving you magnesium supplements. So it's all over. Tuko kila mahali. So there's nothing like we are going to just face kitu moja hivi we finish it up. We are all over. That is the problem. If you understand that, you'll know this one, you'd rather prevent than think of curing. You'd rather prevent than think of cure. So you'd rather drop that seed oil. You'd rather drop that wheat before thinking of curing. And if you see, if you've been keen on this series of cancer, you'll realize that these cancers are operating in the same way. The only difference is the organ that they are attacking. But you'll still see that even if they are attacking different organs, they still spread to other organs. So therefore, this cancer is just the same thing, the same animal. The only difference is the manifestation, the rate under which it spreads. So if you are sharp, you should not be asking, what will then cause bone cancer? What will cause the liver cancer? How do I handle the brain cancer? You will simply know it is the same way. So therefore, if you've been here for the last 3 sessions, you already know what to do to prevent the occurrence of this. And if already you have the cancer and it has spread to stage 4, we cannot help you, will be palliative care. But if you have it, you've already started turning on the genes that actually expose you to cancer. You have the ability to turn off those genes. You have the ability to give the body a chance to fight inflammation and actually help you recover from more inflammation and more cancer, and even to block the spread of this cancer. So you have all the abilities to block yourself from actually having this cancer and having it spread to different organs. Why don't you do it? Which excuse do you have? And as the year is coming to an end, I know because I've worked with you people, there are people who still believe up to now, and a larger percentage still believe that their health is in hospitals. There are people who will still tell me that healthy living is very expensive, I cannot afford it. Because simply they are thinking that I'm telling them to eat the bad foods and still eat the good food at the same time. So they are thinking it's very expensive. But the same people will line hospital pharmacies. They will pay expensively without bargaining. So food is expensive, but you can easily buy drugs without even bargaining. Unajua dawa zangu ni 16,000. Unajua dawa zangu ni 23,000. Tell me how healthy living will take you to 16,000 a month. How? Eating one meal a day. Eating a lot of meats and a lot of eggs, fish, chicken. How is it expensive as compared to those drugs that you're taking? Some of you, specifically women, run to buy supplements that are very expensive for your skin problems instead of just sitting down and fixing the gut, eating one meal a day. So you will prefer eating 5 meals a day, snacking in between, eating all the unhealthy foods, have these skin problems, and then go and buy supplements for the skin. You prefer doing that. So you want to live the same lifestyle and get different results. How is that even possible? And you see, by the time you're getting yourself to a level that you have cancer, you have a diagnosis of cancer, you have really worked so hard to get there. Stop believing the issues of genetics. Stop believing, oh, this is genetic. It's not in the genes, my friends. Please. There's a very minor genetic link. And even those genes are activated by something called epigenetics. And your lifestyle is a larger percentage of the epigenetics. So until when shall I sing this to you for you to get it? Until when? Don't you think it's so expensive to treat rather than to prevent? It is. But look at people who have diabetes. They've been sold the fear that if they drop drugs, they will die. But the same people have never dropped drugs. They've taken drugs for 20 years. Nothing is changing for them, but they expect different results. Eating the same foods and taking medicines. They are hoping, even though maisha yao, eat these sugars, then take a drug. Eat these foods, take a drug. And they are hoping that these drugs are coming in to change their kitchen. Look at people who have hypertension, taking one medication after the other. And the next time they go to see the doctor adds on another combination, 2 drugs now. And then another one, now 3 drugs. And now a drug to handle side effects of the first drugs. People who take nifedipine, people who take amlodipine, they end up having this swollen tongue. They cannot even speak. They end up having swollen legs. They will now be given another drug, HCTZ, to clear the fluids in the system. This is just treating the symptoms of the drugs, the side effects of the drugs. So you take one drug, it gives you a symptom or a side effect, and then the doctor gives you another drug to treat the side effect. How many of you have gone to hospital? You are given a simple painkiller like diclofenac, and then the doctor adds omeprazole there because they know diclofenac is going to mess up your gut. So they have to give you omeprazole. So instead of them just giving you paracetamol, they will give you diclofenac and then add on that list maybe Nexium or omeprazole. And for them, it's money. The larger the prescription, the more the drugs, the more the money. Si ndio? Lakini hatutaki kuona hivyo, hatutaki. Hiyo ndio kitu hatutaki kuambiwa. Ukiambiwa ukweli unakasirika. Ukiambiwa lose weight because fat is going to expose you to more inflammation. Therefore cancer is coming in. You are body shaming me. Ukiambiwa healthy eating is not expensive. How can I eat? Meat is expensive. This is for the rich. But you're somebody who is eating 5 meals a day. How can you even afford 5 meals a day and then still not afford 1 meal a day? Clean keto, 1 meal a day. How can you not afford that? But you're first to tell me, Daktari, this will be expensive. You know, Daktari, I have a very big family, and that's a problem. You have a big family that feeds on 5 meals a day every single day. You can afford that. Right? But now, when it comes to healthy eating, it's a large family. So you love your health. So how can I get you out of your own hell? I'd rather let you burn there until you hit the rock bottom. That's when you seek now advice. And now when I tell you this, you will get the idea. But you're waiting until it drains you financially, until you sell that piece of land, until you actually sell that house, and you have nothing for you to afford chemo, right? Why would you do that yourself? Why are you so negative about real information? I understand somebody sold you the fear. I know. And of course it's our fault in the system. But again, we have been conditioned to think in a certain way. So you can't blame your doctor. He has been conditioned to think in a certain way. And the weird part is, no doctor is willing to actually take in the information. No doctor is willing to be challenged because of ego. And you just follow suit. You don't want to be challenged because of ego. So the doctor taught you ego. And now you call him my doctor, my consultant, my specialist, my. So whatever he says is right. But you've been taking drugs for 20 years. How comes you're still in the same area? He has been your doctor for 13 years. How comes you're still the same person? I thought if he's your doctor, he should be better. You are very bad financially. You are very bad physically. You know very well as you go to see him, you are trying to just imagine, one day maybe I can get a solution somewhere. But at this moment in time, let me just trust the doctor. He has bills to pay. And one day we shall be loud. We are only 1.5 years into it. By the time we're getting to 3 years or so, if God gives us the grace to live tomorrow, we are going to be superhumans. Superhumans. And they know it. They know that you people are dropping the seed oils. They know you people are dropping wheat. They know you people are starting to eat meat. And that's why they are coming in now to inject those cows with those vaccines. These are deals that are striked when they actually look seeking for political offices. We will sponsor you to get into this office. And once you get there, we need you to actually make sure that these people eat our meat from the laboratories that are printed. We want you to make sure that these people are actually following these guidelines. They have to take these vaccines. So yes, we will give you the office, but that office comes with our own demands. We have this on the table. So when you get into office, do this. Do this for us. So don't even be surprised when you're abused for actually asking, why do you vaccinate animals? Don't even get mad, because when you're told that somebody's paying his bills, the fear is gone. So anyway, so once you've understood this, you will know that if I understand cancer better, I can actually handle it, I can actually prevent it. And even if I have it, I'm not going to buy fear, because when I buy fear, all the immune that starts from your head goes down. When I have stress levels, I'm actually lowering my immune system. So what do I do as an individual? I must work on my mind so that I can start boosting my immunity. I must do what I need to do so that I can get better. So if you're wise, you get hypercalcemia, you get weak bones, you get constipation, you get kidney stones, you get increase in blood pressure, and then you get acute pancreatitis, because high calcium levels affect the pancreas. Now you know the pancreas plays an entire role in the digestive system. So now you have an inflamed pancreas. What do you expect? Diabetes is coming in handy. Anyway, we move slowly. So now to the risk factors. So what are these risk factors? Because when you know the risk factors, you'll know to avoid them. Because the risk factors are actually what causes the problem. Okay? So the risk factors, number 1 on the list, cigarette smoking. I have talked about cigarette smoking multiple times, and I've told you that cigarette smoking is involved in over 98% of health conditions. Oh, cigarette smoking is crazy. But you can't listen, right? You even say, I am addicted to cigarettes, I can't help it. Find a solution, bro. Now, you call it them electronic cigarettes, the vape, right? You think smoking shisha until moshi inatokea kwa masikio na mapua and all the orifices is having fun, right? You want to smoke the shisha pot all night long because you know what? I am having fun. Yeah? Yeah? So you want to go that direction. Cigarette smoking is number 1. So if you drop cigarettes, you're actually safe in most conditions. So let me tell you something about this cigarette smoking. Because cigarettes, the smoke, the nicotine, the issues, the radicals that come with that smoke can actually turn on several genes in your system. And they will not turn them off. And the weird part is you can smoke cigarettes for 30 years and then you stop. And then after 15 years, you're diagnosed with cancer. And then you're wondering, lakini siniacha kuvuta sigara 15 years ago. You did not. So listen, there's something called pack years. Pack years is basically how much you've smoked over a certain period of time. For example, there's a formula to actually calculate this. If you've been smoking 20 cigarettes every day, and I want us to try this, so you've been smoking 20 cigarettes every single day. The formula for calculating the pack years, because when the pack years are above 30, of course, you have a risk of getting lung cancer. You even have a risk of getting other cancers, and then lung cancer comes secondary to those other cancers, like the liver cancer, like the brain cancer, the rectal cancer or the colorectal cancer, the breast cancer. All of them, cigarette smoking is actually linked to it. So pack years, you simply take the number of cigarettes that you've been smoking every single day, and then you divide by 20. And then you multiply that by the number of years that you've smoked. So why are we dividing it by 20? It's because we are calculating pack years. Pack years, the pack. So a pack of cigarettes has 20 cigarettes inside. Don't ask me how I know this. Of course, I had to know it because I had to know how to calculate this. It's not one of the things I've never done is to smoke a cigarette. Hiyo hapana. Hiyo naambia ukweli, tawe. Hiyo ilishinda. Even sitting in a room that people are smoking, I'm like, tawe. This one, no way. So that one, God gave me the grace to say no to it successfully. But hizo zingine, hizo zingine, I never even had the urge to actually try shisha. No, I was like, hapana. So I used to think of my lungs looking like the suit, ile suit in the kitchen. Unajua mimi nimetoka mashambani, I understand how that suit looks when it's hanging in the kitchen. I'm like, I don't want my lungs to look like suit. This one tawe, I can't do this. Okay? So pack years, you're taking the number of cigarettes that you smoke on a daily basis. So if you're smoking 20 cigarettes in a day, let's say 20 or 30, let's use 30. So I want you to try and calculate this. So you do 30, the number of cigarettes that you smoke in a day, over the number of cigarettes in one pack, which is 20. If your pack is 25 cigarettes, divide by 25. But the constant is 20. So you have now the number of cigarettes that you smoke on a daily basis over the pack. The number of cigarettes in one pack, that is 20. And then you multiply by the number of years that you've been smoking. So let's try this. You've smoked 20 cigarettes every single day for 35 years. What do you think is the number of pack years? Tumeanza darasa. Now it's time for you to run away. So you've smoked 20 cigarettes every single day for 35 years. What do you think is the number of pack years? How many pack years do you have? Let's see how many are concentrating. Mathematics was a problem. How many of you need a log table? Oh, there's a biostatistics. Where there was a table that was called, I think, SMP or something like that. My friends, if you expect me to come here and teach biostatistics, I'll never do that. I apologize. There was a table called SMP table. I saw people carrying that table in an exam room, and I was like, where are we using this? I'm like, but mwalimu, I'm like, mwalimu alifunza. He came with it. Yes, we had a copy. I'm like, hey, that was a free lesson. Hey, if you never suffered by stats, you're a bright person. Wewe ni mwerevu. Biostatistics. I thought I was done with mathematics in high school. Where? Hey. Kama kwa kitu kinafanya niache shule ni hiyo. Kwani lazima nifanye hii course? Let me just go. Anyway, yes, people are getting it. 35. Now you see. So you simply divide 20 by 20 and then you multiply by 35. That gives you 35 pack years. 35 pack years. That is the answer. Don't just write 35. If you write 35, where is the 35 what? Cows? You know those mean teachers, right? 35 what? Were they cows? Were they goats? What are you calculating? Now he gives you half a mark. And now you have 49 and you need 50. Now you failed. Okay? So you must write 35 pack years. Okay, good. So now we have 35 pack years. And everybody who has over 30 pack years must be screened for lung cancer. If you have over 30 years of pack years, be sure, wewe, direct ticket, you must be screened for lung cancer because you're already highly exposed. Mona. So this is a high risk factor. So risk factor number 1 is cigarette smoking, and the highest risk factor is having a pack year of above 30. 30 and above, very much trouble. Number 2, there are people who work in mines and they inhale a lot of gases in the mines, whether a gold mine or the coal mine, they inhale a lot of gases. These gases are going to expose you to lung cancers. There are people who work in the fields spraying chemicals like herbicides and pesticides on the crops. Exposure to that is going to expose you to lung cancer and even other cancers. Asbestos that we are getting from most of the sufurias that are non-sticky, that we are getting from the roofs. We are going to give you this. Somebody has just mentioned it here. This is Mike. Thank you, Mike, for that. And also ionizing radiation. Part of the ionizing radiation is are the x-rays. Oh, unajua mimi nasikia kama niko na pneumonia, unaingia x-ray, unapigwa x-ray. Pigwa x-ray 3 times a year. What are you trying to look for? Every year you're getting 3 x-rays. And then now kidogo you are unable to breathe. So therefore asbestos is there. Irradiation like ionizing radiations are there. Exposure to the microwaves all the time, they are there. There is this radioactive iodine that people use to actually treat the thyroid problems is there. So be very cautious about the things that you do on a daily basis. You need a basic life. It is easy to live a basic life. You don't need a lot of things in your life. Even the diets, you don't need a variety of foods. You need foods that will feed your body with nutrients. So you don't need a variety of foods that mingi. Oh, mara unataka biryani, sahi unakula mchele ya white, mara mchele ya brown, mara unataka pilau. Hiyo yote ni mchele, ni kitu moja. Angusha hiyo, umeshaangusha a lot of things. Anyway, we have chemical pollutions and pollutants like even diesel. The exhaust that is coming from these vehicles. Nowadays all of us are buying vehicles. Where? There's something called silica, exposure to silica problems. We have people who have rheumatoid arthritis. Very high chance they might end up getting this problem because autoimmune conditions like rheumatoid arthritis, not only will they exacerbate you getting this condition, they will even increase the rate of inflammation. Therefore, they help the disease or the cancer to spread. Remember, we said cancer spreads so fast through inflamed tissues, right? So rheumatoid arthritis is there. TB, every time you have recurrent TB, is a risk factor. Heavy metals. Which heavy metal do you know? I've told you about the ones that are in skin lightening products. Chalk dust, chewy. Chalk dust is coming in as a pollutant. Okay? So it's actually part of the pollutants and the chemicals. Mercury is there. Lead is there. Thank you for the answers. So you people know these things. And these are things that are part of our products. Our skin products have mercury. The skin lightening products, they have mercury. Go and see. Even the things that we use, I believe, because belief hails from a scent of doubt, I believe they have ruled out that feeling, the dental feeling, which was amalgam. Amalgam was a problem. Parabens, but parabens are not heavy metals, but parabens are things that actually expose us to mutations. There is one thing that I need you to know. The firewood for cooking. Hey, bwana. Hey, wacha hizo bwana. You have another one called uranium. Arsenic is there, which is part of the tampons. But anyway, let me tell you something about the heavy metals. There is a compound that is mostly used in most of our products to actually give color. Okay? So if you read on any product that has a color, anything that looks red or blue and it has a color, mostly red things, and you read the ingredients and you see something called titanium trioxide or titanium dioxide, please drop it. Hello? Go into that kitchen right now. Somebody is saying Teflon on cooking pots. Yes. Teflon is something that's going to expose you to a lot of problems. Now, remember, as you're mentioning those causes, understand that lung cancer can come in secondary to other cancers. Look at your products in that kitchen or in that house. If you see something called titanium trioxide or titanium dioxide, allow me to check one product that is very obvious in your houses so that you can actually check it. Just give me a minute. Let me just see. I want to see one. I know. This is part of most of the things that we have in our households. Titanium trioxide. It is mostly in our paints. Zile tunatumia kupaka rangi. It is in the sunscreens that you people are using. Umeenda Mombasa hii holidays, ndio umepaka sunscreen. Yes. Oh no, my sunscreen has titanium dioxide. Njoki, you got it. It is in the sunscreens. And when I tell you about these things, you people ignore. Titanium dioxide or titanium trioxide. Let me mention another thing. I have to make sure. Some of it is in the hand wash. Zile vitu mnatumia kwa kuosha mkono na kusanitize. I don't want to mention them because if I mention them, there's somebody who will get upset. It is in those chewing gums that most people are using that have a lot of colors. Well, I chew gum to make sure that my mouth is fresh. Tim could chew gum to make sure that my mouth is fresh. And your mouth has to be fresh because you've chewed gum. You just taken sugar and titanium trioxide. Oh, this is so crazy, my friends. There's another thing that I'm so sure it has it. Let me just confirm. Let me just confirm before I say this. I must confirm that it's there. It must be there. You guys, there are a lot of bleaching soaps. Yes, I've actually seen bleaching soap here. I must have seen it on some toothpaste brand. I must have seen it. I must have seen it. Let's continue. So as you read the ingredients on every product that you're taking, please make sure you go to the ingredient levels and read it keenly. If any case it has more than 4 ingredients, just drop it. Food colors are part of that, I'm telling you. And this titanium trioxide or dioxide is actually used as a colorant in most of the medicines, in most of the commercial toothpastes, and in most of the food coloring, the foods that have colors. Oh, you will thank me. You will thank me. You don't need a chewing gum to have fresh breath. You need healthy diets. You need to use salt or coconut oil or bicarbonate soda for brushing your teeth. You need to change your diets. Oh, and now let me mention to you some of the genes that are actually involved in this type of cancer. I don't want you to cram these genes. Don't even try to cram these genes. The only thing you need to do at this moment in time is to like the live. Thank you. You're not Magonga. The only thing you need to do now is to like the live so that it gets to reach to more people. But anyway, let's continue. So some of the genes here.
The Bluetooth device is ready to pair.
What is happening here with the Bluetooth all the time? Anyway, this is what is happening. I want you to know, charcoal too good for teeth? Yes, charcoal, whether activated charcoal or grounded charcoal, use it. Okay, good. So these are the genes. And you remember, we mentioned 3 things when we were talking about the basics of cancer. We mentioned the proto-oncogenes being converted to oncogenes to cause cancer. We mentioned the tumor suppressor genes that actually suppress the multiplication and growth of cancer. We mentioned the DNA repair genes that actually come in to repair the mutations. You remember that? I hope you do, because these 3 are the basics of cancer. So when you have proto-oncogenes, you will not have cancer. But when you activate them and they overreact to form the oncogenes, you now have cancer. So the more the oncogenes, the more the cancer. The less the tumor suppressor genes, the higher the cancer. The less the DNA repair genes, the higher the cancer cases. Now, the oncogenes that are responsible for lung cancers. Number one is KRA. KRA. Kenyans with KRA. KRA is part of it. Number two is BCL2. So when you see lab tests that are actually indicating either KRA or BCL or HER, which is HER2, you'll simply know they are trying to actually diagnose me of lung cancer. So now I'm helping you to interpret those tests. So HER2, BCL2 and KRA. Hapo kwa KRA ndo tuko pamoja, si ndio? And then for the tumor suppressor genes, if you have less of them, the tumor suppressor genes that are actually responsible to help you suppress this. So when you have less of them, you'll suffer. PS3, RB1 and P16. Now, I don't want to even cramp these genes because I'm just showing you that there's a genetic link, but it's very minimal because these genetic links is actually the ones that actually are activated by the diets and lifestyles. So how can you expect to consume titanium dioxide? How can you expect to consume wheat, sugars and all that, and then expect not to have these genes activated? You will have it. Just like KRA must be everywhere. There is pain. Hey. KRA and ha. Yeah. They're going to destroy us. Where there's pain, there must be. Amazing. Who is this? Uribe. Hey, that was attacking and defending at the same time, my friend. So now you understand that. So let's get into the treatment and management because now you've understood the risk factors. But again, let me just talk a little bit about diagnosis. Most times, people are misdiagnosed of cancer because they have maybe the nodules in the lungs, or they have this obstruction, or they've had TB, recurrent TB all the time. They've taken medication and all that. Somebody's asking a very genuine question. Doc, what about radiation from Wi-Fi? Wi-Fi, your phone, all these things, your laptops, they radiate. And those radiations can be very dangerous. That's why we tell you, when you're submitting yourself to bed, make sure your phones and all these things that are radiating any form of radiation have to be far away from you. So those of us who keep on sleeping with our phones in the beds, please, don't do that yourself, okay? It's not only about the lung cancer, Njoki. It can also be other types of cancer. And remember, all other types of cancer can actually spread to actually bring in the lung cancer, okay? So through metastasis, because that's what kills you. What kills you is not the cancer, it's the cancer spreading to affect other organs. So anyway, you go to diagnosis, you get all these types of diagnosis. You start with the chest x-ray, you go for, they see a nodule, they refer you to a CT scan or an MRI, you go and have a low-dose CT scan, you get now these images that are actually crazy, you're forwarded to a PET scan, and the PET scan shows, oh, there's a problem here, and then now they recommend biopsies. All those tests, you're actually spending a lot of money. And then the biopsy comes in, and before they even do a biopsy, they send you for the PET scan or even the CT. And then because there's a nodule in your lungs, they decide, you know what, this must be, we must question cancer here. And now you end up getting a negative or a positive, what do we call it? A false positive, sorry. So a false positive. Why do they keep repeating the PET scan? I will tell you something about the PET scan in relation to this lung cancer, and then you will see why they do that, okay? So just relax. So, as you screen yourself every year, because when you have a PACI of above 30 or you have exposure to these risk factors, you need to screen yourself basically every year. Imagine that. It's hectic, right? But this is the point. Just checked my Nivea sunscreen. It's there. At me. You see, I am not crazy. That sunscreen that you're using, exposure. So imagine if you're a lady, you're using sunscreens and then you're using hormonal contraceptives, you're using skin lightening products. Hey. You're using microwaves, you have a phone and a laptop, and exposure ni mingi. These are things that we have control over, sindio? Let us use those things that we don't have control over, let them be. At least hizo tutasema, we tried, we did not manage. But the ones that we have control over, let's not do them. You don't need any sunscreen if you are from Africa. If you're not an albino, why do you need a sunscreen? Why don't you allow your skin to go through the normal process? Exposed to the sun, let it shade off. It will shade off and it will come back. Apply coconut oil instead of sunscreens. Anyway, so you need to screen yourself basically every year. But always be careful, and this goes to the doctors also, be careful of the false positives. Be careful of the false positives, because these results they kill people. Do you know the burden that will come to somebody who has just been diagnosed of cancer? Do you know how you will drain this person financially, emotionally, physically? Do you know how these people will lose weight from just getting the diagnosis alone? It's the same thing when you get a HIV scare. You lose weight so fast. So, when you have these PET scans, when you have these MRIs, when you have these biopsies, and then you end up getting a false positive, you're going to affect these patients totally. So you need to actually do a lot of things to make sure this patient really gets the diagnosis. Don't be quick. Usiharakishe. Be slow. It's not an emergency. Just be slow. You will find your answers. Appropriate medical history, appropriate physical examination is going to give you what you really need. But the problem is we are always in a hurry, going nowhere. Tunakimbia tu kwenda nowhere. You just want to clear the lines. So this is the problem. When you tell a patient, you know what, sir or madam, I hate to bring this or break this to you, but the true story is that I saw a nodule in your lungs when I did a CT scan. And it could be or it could not be. I'm not saying it's cancer. You see, you're already trying to sell him or her the fear. I suspect it can be a cancer, but I'm not saying it's a cancer, but I suspect it could be a cancer. So that's you as a doctor saying this to somebody. I suspect this could be a cancer. There's a nodule that I've seen through this low-dose CT scan, and I've seen in your lungs there's a nodule. And I'm suspecting there's a chance that you have a lung cancer. This guy is already sweating everywhere. And then you tell this person, you know, we need a biopsy to just confirm my doubts. We must do a biopsy so that we know if you don't have cancer. But immediately you said, it could be or it could not be cancer. This guy, in his head, is thinking of the worst already. So sometimes the way you deliver this information must be reasonable. When you just said, I'm suspecting that this could be, this guy is already having cancer. He's already thinking chemo. He's already thinking, oh, you know what? One of my relatives took chemo and when he died. I've had a lot of information about chemo and it's crazy. I don't want to go through chemo. God, why me? Problems, right? And I want you to imagine it's you who is being told that. I have seen this nodule and I'm suspecting this nodule can be. Either it's a cancer or not cancer, but we need a biopsy to confirm. Now you jump into the denial stage so fast. And these are the signs of the denial stage. Because step number 1, once you're told this, you're like, cancer. Hey, cancer, haiwezi. Bro, haiwezi kuwa cancer. It can't be cancer, daktari. Cancer, me cancer. How? Me cancer. How? So you jump into the defensive mode because you don't want to agree to it or accept that possibly there's a chance for you to get cancer. Ni shetani mgani huyu ananiona hivi? Why me? And then the second stage of denial, these guys go and read thousands of blogs and journals that are and most of you know this. When you have a HIV scare, for those of you who have ever had it, you will simply run on the internet to just see the early signs and symptoms of HIV, what the HIV people go through, how can I treat HIV without using drugs. You're going over and doing this. And as you're Googling this or you're reading journals, everything that those journals are saying, you're experiencing it. Because of anxiety, your gut is overreacting, there is a diarrhea. And you've just read there's a symptom of diarrhea here. The early signs of HIV is diarrhea. And now you have a diarrhea. You're thinking the worst. You're still in denial though. Oh, rashes. You look at yourself, you ate wheat the other day and there's a rash. You've just seen, rash. Wow. Kidogo. Anxiety is coming in. There is a flu. And that flu, you're like, runny nose. Early symptoms of HIV, the first 5 weeks, there is a runny nose. You're like, Wallahi, every symptom is coming true. This is the same thing that is happening when you're going through this cancer thing. It's not a joke, my friends. We can laugh about it, but it's not a joke. So this guy is so nervous, he's so tense, he's panicked, and he's thinking, why is it happening to me? What have I done wrong to God that I deserve this punishment? He's still in denial. Now he's busy trying to research And everything is researching is coming through WHO, coming through those organizations that are actually feeding you the same things over and over. And now this guy is so afraid. He's reading all journals, all blogs, he's watching all YouTube videos that have talked about cancer, and every single one of us is just saying things that are actually selling you fear. We're just saying things that are actually imparting a lot of negative things in your head. That is the denial phase. But this phase is what most of you are in. It's actually called the intellectualization stage or phase. You are moving into the intellect. You're thinking now you know much about it. But why would you not read about these conditions when you are still sober and still healthy? Why would you wait until you get a diagnosis and now you start reading deep about it? And you'll see most people know much about HIV, know much about cancer, they know much about diabetes and hypertension from the time they have been diagnosed with this disease. Not before. Because most of you start paying attention when it hits you. Before it hits you, you will always shout here, mbinguni tutapewa mwili mpya. Mbinguni, nijinyime hapa tena nijinyime mbinguni. Mbinguni Mungu atanipea mwili mpya. But you know deep within, as you're saying that, you know, from inside you are so afraid of the cancer. But you can't read about it. When it comes to hit you now, that's when you want to pay attention and start reading all this information. And the more you read, the more you dig your own hole. The more you go into denial. So you're digging a pit for yourself every time. Now you move to stage 3, which now you have now accepted. Now you decide to sell that piece of land. You decide, you know what, I have to sacrifice the school fees for my children. You know what, there's a lot of expense here. I must kick my wife out now because I can't take care of her and I need this money. Now you go into loans in the banks and you go and fund that biopsy. After you funded that biopsy, you are in debt, you don't have land, you've chased away your wife, you don't have anything, umeuza mpaka ng'ombe. And guess what? The biopsy tests and results come out, you are negative. And they tell you, you know what? It was just a benign hematoma. Aye. Yeah? Now you've taken your biopsy tests and results to the doctor and he tells you, you know, this was just, the evidence is here now. It was just a benign hematoma. Daktari, did I have to sell land to know it was a benign hematoma? So be very careful about these false positive results. And this is going to the doctors and the medics who are actually doing the examination, patient examination, and they're taking the history. You must be very detailed before you decide to actually waste these patients' money and resources to send them on different tests. For example, why would I send you for an X-ray and then send you for a CT scan? Yet I know very well, during that X-ray, if there's something I'm suspecting, it will still be seen through the CT scan. So why don't I just drop the X-ray and save you that money and you go ahead and do a CT scan? But I prefer sending you to an X-ray, you come back, I send you to a CT scan, you come back, I send you for a PET scan, you come back now a biopsy. Why did we become so evil? Anyway, let's continue. So take appropriate medical history, take appropriate medicine history, examine the patient totally so that you rule out any other conditions. Go deeper into their family history and see all these things. And then now you can jump into the lab tests. You can do a full hemogram or a complete blood count. You can do a liver function tests because you see, most of these conditions, most of these lung cancers are secondary to liver cancer, to colorectal cancer, and to breast cancer. So rule out high estrogen in the system if it's a woman. Rule out colorectal cancer if it's a man. Have they been on medicines to control gastritis all the time? Have they used the H. pylori kits multiple times? Have they been on TB treatment? Have they treated pneumonia all the time? Go deeper into this. You will find your solutions there. Send them for a CBC, a complete blood count, to see if they have low blood levels, to see if their parameters are in order. Send them for an LFT to see if their alkaline phosphate levels are okay and their liver function enzymes are okay. And then send them for a sputum cytology to just ascertain that this is not TB, this is not pneumonia, this is something else. Send them for a CT now. A CT, and if you're doing a CT scan or any scan, make sure it's the chest, make sure it's the colon, make sure it's the pelvic, and make sure it's an abdominal CT. Why? Because for abdominal, we are looking at the the liver cancer. For the pelvic, we are looking at the colon. For the chest, we are looking at the lungs. So all these are combined because we cannot rule out the occurrence of other cancers and focus on lung cancers alone. We must make sure that we are doing all this to make sure that we are ruling out the occurrence of these types of cancers which would have metastasized into the lungs. You see that? So you become so detailed. You'd rather take one day on one patient, but make sure you've done justice. And then after that, now you can send them from radiologies and all that. So you basically start with the examination and then lab tests and then now radiology. Because the examination and the lab tests will forward you into the radiologies and the CT scan and the PET scan. Now I want to talk to you about this PET scan. Normally PET scan, we simply inject you with a radioactive tracer that will show us there's a problem somewhere. And then we give you some time. And when we've injected that radioactive tracer, of course you'll feel some form of cold, there's some form of discomfort because it's going into the system. And now we give you some time to just relax and wait. After it has actually taken course, now we take you into the scan. And then this scan will portray these images. And these images will tell us if there's something. Now our radiologist will interpret these results for us. And now we can do what we need to do. That is the order. Inject the tracer, give some time, take them through a scan, and then interpret the results and the images. And now you have your results, and now they can tell us what to do. The same thing is happening in this lung problem. Now you see, for this PET scan, you simply inject somebody with glucose, high levels of glucose. Why are we injecting with glucose? I will hold this thought until you people answer me. Why do you think on this PET scan we're injecting this person with glucose? Let me see people who actually concentrate in class. Of course, my students are always concentrating. And of course, we need to think critically. We need to become doctors, so we must think critically. So why do you think we inject this person with glucose? Let me just see people who actually understood the basics from day one. The basics from day one. Why do you think we give them glucose, high dose of glucose? Uribe. Uribe amekaa fraud bench. Ya hapa tu. Uribe is just here. Hakuna kitu nakupita. Everything is getting in and sinking. Very good answer. That cancer cells love sugar. You're very right. Cancer cells thrive on sugar. So we expect once you give you sugar, they multiply rapidly. But on this one, the most important part on this one is, apart from them starting to multiply rapidly because of the sugars that are coming in, they are going to shine, because as they're taking sugar, they're going to shine. So when you see that image on that board, on that screen, you're going to see shiny cells. Very rapidly multiplying, and they are very shiny. That's the reason why we are giving you sugar. So we inject you with glucose, and then these cancer cells will feed on the glucose, they multiply rapidly, and of course, as you're taking some time, they are becoming shiny because they're taking in a lot of glucose. Now we can simply interpret that on the shiny scale, on the shiny images, and we see, oh, this one could be now cancer. Now we can confirm this one has to go for the biopsies. Is it not amazing? Yeah. You people, you're doctors, but you just don't know. So now you go for tissue biopsy, and when it comes out, now we can actually advise. But you see, for the lung cancer, at stage 1, at stage 2, at stage 3, you can simply do chemo. So stage 1, stage 2, stage 3, chemo, radiation, possibly a surgery. But we've said the prognosis is very poor. Okay, so when you're diagnosed with this, of course, it's not the end of the world. There's something you can do to actually make sure that you prolong your lifespan. But the prognosis is always very poor. And now when you introduce the chemo, the radiation, that are actually going to give you more side effects of the same thing that you're actually suffering from, that becomes questionable. So stage 1, stage 2, stage 3, all of them, surgery, chemo, radiation. That's how bad it is. And then stage 4, which is just palliative care. There's nothing you can do when it's getting to stage 4. At this moment in time, it has spread to different organs. It is in the liver, it's in the heart, it's in the lungs, it's in the brain, it's in the colon. It's literally everywhere. So there's nothing you can do about it. And because it spreads so fast, the earlier you get the diagnosis, the better. But the earlier you start prevention, the better. Don't wait for the diagnosis. The earlier you start the prevention, the better you are as a person. I welcome questions regarding this cancer of the lungs. So when I have those questions, I will answer them, and then we call it a night. That will mean we have covered cancer in general. We have covered pancreatic cancer. We have covered lung cancer. We are remaining with colorectal cancer, breast cancer, and prostate cancer. Those three. And this one we will cover next year. So possibly tomorrow, we will be here covering colorectal cancer. So you can be here to actually enjoy the lecture on colorectal cancer. Because once we are done with this cancer series, we will not come back to it until it's totally necessary. So we wanted to clear the series of the cancers, and then now we can go back to other businesses. So if you want to prevent this, simply go back to the place where we talked about the risk factors and avoid those. Just drop them. Don't be lied to that if you are smoking cigarettes, you are at danger. But if you change the cigarettes to vape or to shisha or to nicotine patches, you are safe. You are not. You are not. And I want to tell you this for free. All cancers are the same. The only difference is how they spread and where they spread to. Like if somebody understands colorectal cancer, they will know this one has a high chance to spread to the lungs. Therefore, lung cancer comes secondary to colorectal cancer. If you understand leukemias, you'll simply know that leukemias can actually spread to different organs through the blood. Therefore, these are secondary to the blood cancer. So all cancers are the same. The only difference is the truth where they spread through and the organs that they affect. Okay? Amazing. There are comments here. We just try to turn this on and see. So there are comments here. Somebody was saying, my girl has missed her period. Hey, Kevin Yawa. Kevin Yawa. My girlfriend again. Tawe, that one you're not answering about periods and all that. Doc, how does one take care of a face that continuously has acne and rashes? We've said this multiple times that acne is estrogen if you're a woman. If you're a man, acne is a messed up gut. Fix the gut. Take some time to go through my videos, the live that I did about gut fix. You'll see the answers are there. And if you continuously go ahead and use those chemicals to actually fix acne, you are fixing the symptoms. Acne and skin conditions are symptoms of a messed up gut. Fix the gut. Does esophageal cancer spread faster to other parts of the body? The answer is yes. Because it's lined by the lymph, and it's also lined by the blood vessels. So that's a problem. Yeah, in women it's high estrogen levels. Acne is high estrogen levels in women. That's why women who are using contraceptives, they have a lot of acne. Women who are obese have acne because of high estrogen levels. I have been chewing every day for the longest. It used to be like my cigarette. But when I met you, Doc, I dropped sugar together. I don't chew anymore. Rose Mbevy, congratulations. We are sugar addicts in denial. We keep on taking sugars and we think that something is coming in to save us. Nothing is coming in to save you from sugar addiction. As you eat those fruits, as you chew that gum, you're actually chewing chemicals. You just don't know. And you're lying to yourself that because I'm chewing, I'll not have a bad breath in my mouth. You will still chew. And have you ever realized when you chew gum, about 10 minutes after chewing it, you're already bloated? Have you ever realized that? I'm an mimi too. I used to chew gum and 10 minutes down the line, I'm so bloated. And I've just chewed that pack of PK. Or was it what? Fresh or something? Oh, you feel a lot of bloating and you're wondering, this is bloating imetoka wapi? Then you start belching. And as you're belching, you're taking another one. Aye. So ladies and gentlemen, thank you so much for attending this live. This was a cancer live, a lung cancer live for that matter. And I hope that I've done justice to the lung cancer. We'll be here tomorrow at the same time. We'll be tackling the colorectal cancer. We'll clear these cancers. And then after that, we will come back next month to speak about the prostate, both prostate enlargement and prostate cancer, and also breast cancer. And we can combine breast cancer with cervical cancer so that women can actually understand where this is coming from and the problems that they're actually facing by taking those contraceptives. But I hope that you can actually take care of yourself. I hope that you can actually wean off the addictions that you have this month. I hope you can actually stay calm when people are actually getting excited, drinking alcohol, smoking cigarettes and bang, and eating all the inflammatory foods. And I hope you can actually maintain your discipline so that you don't come back in January obese as crazy with the cravings of chapatis and all that. I hope you just maintain the discipline. You can. It is not an easy journey. It's not a journey for everybody. It's a journey for you. Walk it alone. Thank you so much. If you've not liked my videos, please do yourself an honor of liking those videos, because you're not liking it for me. You're liking it to actually make sure it spreads to other people. Remember, the system is crazy. The system keeps on limiting this information, blocking the spread of this information. So your like, your share is very important to us. As we build you with the health information, build us with the like and build us with the follow. As we become bigger, they'll start listening to us. And I know 2 years from now, we'll be a whole different generation and a whole different movement. So thank you for making us a movement. Health and Wellness Sport is not just a YouTube channel. It's not just a TikTok channel. It is a movement, and it's actually changing lives of people for the better. So keep doing what you're doing. Keep helping us grow, and as we help you grow in terms of health, we appreciate you for everything. Support us through buying our merchandise. Support us through super chats. Support us through M-Pesa messages if you can. And we'll keep doing this over and over until all of you are getting better and you get out of this bondage. Remember, my role is just one. I come in between you, the public, and the health systems. And when I come in between, I bridge the gap so that you understand healthcare in a language that you can easily interpret it. And when you choose to take medication or medicines or healthcare, you consume healthcare, you're doing it with a sane mind. A lot of us have parents, relatives, and even ourselves have suffered a lot in the hands of the rogue healthcare systems. So when somebody is coming in to stand up for what is right, support them with all you have. You don't need to support me financially. Just support me with a like, a share, and a subscription. Once you do that, I feel motivated. I keep on doing these things. And even if you don't do that, I still do it anyway. But we hope that you can actually be generous enough to follow us, to subscribe to our channel, and be generous enough to share the information to other people who really need it. So thank you so much for doing this. We wish you a very good holiday, a Merry Christmas, and we'll see you tomorrow at the same time, same platform, same doctor, same channels. It's always amazing to have you here. Thank you so much, and have a good night.